The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Mercy Medical Center, and, of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our special guest, Dr. Michael Linz, whose picture is void for a moment, but he'll come back, Chief of Hospital Medicine at Mercy Medical Center, is joining us via Zoom. Good morning, Dr. Linz, and welcome to the show.
Good morning, Paul. Good morning, Brad.
Good morning. When we last spoke with Dr. Linz in January of this year, boy, to say the least, the world's changed dramatically since then, and it's kind of a massive understatement. But one thing that hasn't changed is Dr. Linz's commitment and dedication to patients at Mercy Medical Center. Hospital stays can be full of surprises, and one of those might be the doctor that shows up to help treat you. As a patient, this might be intimidating until you realize that Dr. Linz and other physicians like him are better qualified to care for patients during their hospital stay. Today, patients admitted to the hospital tend to be more severely ill. Hospital-based doctors can better attend to such patients, respond to their problems, and navigate hospitals' increasingly complex systems. Today, we're going to talk with Dr. Linz about everything from COVID-19 updates to the Cleveland Clinic acquisition of Mercy Medical Center. We'd like to remind our listeners today that our program will be available on our podcast, so please check out Health Matters with the Medicine Center Pharmacy in your favorite podcast app and subscribe to our program.
So, Dr. Linz, welcome back. I understand that just like your last visit, you have prepared a brief pop quiz for Brad and me. We didn't study, but we'll give it our best shot.
Well, that sounds great. I thought I would start with something a little lighter since a lot of the topics today are pretty serious. I think during the height of the COVID pandemic, most of us spent a lot of time indoors watching movies, whether they were new, old, or in between. And so I thought to myself, as a pop quiz to you two, if you could figure out what are the 10 top doctor-related movies that are my favorite of all time. And that can be either movies or TV shows.
Okay, gotcha.
Knowing my age.
Okay, I'll go first. Okay. How about Dr. Oz, Dr. Phil, Ben Casey, Dr. Kildare, Doogie Howser? What's up, Doc? And that was that's a little off the whatever, but Doc Hollywood. Okay, that's all I got.
I'm thinking about MASH.
Yeah. Okay.
MASH is number one.
All right.
So Doogie Howser was number two.
Okay.
A lot of the other ones were on the top 10 list, or on the top 20 list, that didn't make the top 10.
No.
They'd heard about Dr. Kildare and about Ben Casey a little before my time. When I was quite a bit younger, they used to call me Dr. Doogie Howser.
Okay. Well, wasn't Dr. Kildare? It was a movie originally, was it, back in the 30s or something like that?
Yeah, and then a show with Richard Chamberlain.
And then a TV show. Yeah, right.
So MASH was first with Hawkeye Pierce. Doogie Howser was second. Dr. Richard Kimball in The Fugitive was third.
Yeah. Oh, yeah. I forgot about that.
Yes.
Mm-hmm. Dr. Quincy.
Oh, yeah.
M.E. We used to watch that in our anatomy lab in med school.
Okay.
Of course, Marcus Welby.
Oh, yeah.
Dr. Jack McKee, which was William Hurt in a movie called The Doctor. House,
huh? Gee.
Patch Adams.
Okay.
Oh, yes.
There was a TV show we watched when I was in med school called St. Elsewhere.
Yes. Okay.
Multiple folks we like there. Mark Harmon, William Daniels, David Morse all played different physicians. So that was kind of an ensemble. Then I had to put a sinister doctor in, Dr. Hannibal Lecter.
Yeah. Gosh. Okay.
So those were part of my laundry list. I thought that would add a little levity to the situation.
Oh, my gosh. Okay, doctor. So tell us a little bit about yourself and how you got involved in this specialty.
Well, I'm a native of Canton, born and raised here, as is my wife and children. Went to Glen Oak High School, did my undergrad and graduate school in the combined program at Neo-UCOM, now NeoMed. Went through the 6-year program there, did my residency at Mercy and Altman, was in private practice for 25 years, and now the last 8+ years have been involved in the hospital and administration and teaching. And about 4.5 years ago, they asked me to take over and run the inpatient hospital program, so that's been my focus over the recent past.
So are you working with, I don't know, they don't call them interns anymore,
resident physicians.
Residents, yeah. Are you working?
That's part of my teaching. The major role I take is actually overseeing a hospitalist group that are all board-certified attending physicians that specialize in hospital medicine. We have 20-some physicians and practitioners who work under me.
Gee, many, wow. Okay, to say a lot has changed since your appearance on Health Matters in January is certainly an understanding of the centuries. So share with us the impact of COVID on Stark County, Mercy Medical Center, and healthcare globally.
Well, it's a large topic, and I do remember when we were just scratching the surface talking a little bit about COVID at the end of January, and I think to say that we underestimated this was probably an understatement. It's really hard to believe that this microscopic virus basically changed the world and put everything to a halt and affected not only health and welfare of the community, but economics, employment, the arts, education, travel, pretty much every single part of our society, and not only nationally, but internationally. So even though we were relatively prepared, we had no indication of the breadth and depth of what this would do to our society, and pretty much brought everything to a halt for a period of probably 6 to 10 weeks before we saw any light of day.
You know, this COVID-19 topic is on everybody's mind, and it's all we talk about. You know, hey, how's it going today? Are you feeling good? We take your temperature every place you go. You know, it's just nuts.
It is. It does create some fatigue after a while discussing it, but it's the major topic of our globe. The only thing that I can associate it with is the beginning of the AIDS epidemic in the late 80s. The mid to late 80s when I was a resident and a medical student. But this is much more far-reaching, much more lethal, and has the potential to globally fit the bill to affect anybody.
So what's the definition of COVID-19? I know it's a virus related to flu, correct? Or
kind of. I mean, the viruses have similarities. So COVID is a part of a family of viruses called the coronavirus, and there are various types of coronaviruses that have various degrees of virulence. But they've been out in our community for a number of years. What's different about this virus is that they call it a novel virus. That is, it's a new virus. It's a mutation of one of the coronaviruses into a brand new biological agent that we never knew existed before. So it's called the SARS-CoV-2, and the SARS stands for Severe Acute Respiratory Syndrome, based on the type of symptoms that it causes patients. As you know, it was first isolated in Wuhan province in China in December of 2019 and pretty much spread rampantly throughout the entire world over a period of 2 to 3 months.
They got us, didn't they? Boy. Go ahead, Brad.
Okay. Well, we've had some updates here, especially in Stark County. Do you want to give us an update on your current take on the status, both nationally, on a state level, and even here in Stark County after yesterday?
Yeah, I was prepared to discuss a lot of the areas of improvement, and I think we still will. But Stark County just increased their level of concern from orange to red, which means there's a high potential for infection. And it's based on the amount of infections per 100,000 patients and the percentage of infections, as well as those individuals that are infected that were not part of a group setting or something along those lines, so individual folks. So that raised our alert level. We have not, at Mercy, seen a significant uptick as of yet, but that can change on a day-to-day basis.
We had all those tents set up outside the hospitals, early on, I guess earlier in the year. Were they ever used very much?
Not really. They really weren't. I mean, one of the things that I think was very important in Stark County was the degree of preparedness that was undertaken by not only the hospitals but by the city and county health departments. This was a proactive action, done by the hospital. We started preparing for the pandemic in early February, and we had a incident command center. We met regularly twice a day, including the weekends. It was a very intense time, but under the leadership of Barb Yingling, who's our chief nursing officer and vice president, we basically took the bull by the horns and put together a multidisciplinary committee that we worked with the city and county health departments as well as the state Department of Health, and were able to get the word out and have ourselves prepared from the standpoint of negative pressure rooms to a tent outside for triaging folks who may or may not be ill, to overflow rooms and ventilator preparedness. It was a huge undertaking. Fortunately, we in Stark County never had to engage those extra resources into play, but we had to be ready because those who weren't ready obviously took the brunt of the illness.
Why don't we take a break here, and maybe your IT guys can get your picture on a computer.
That would be great. Thank you.
Okay, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back. The Medicine Center Pharmacy. Brad and I are talking with Dr. Michael Linz from Mercy Medical Center about COVID-19 in Stark County.
At the break, we were going to talk about kind of just a refresher primer on COVID-19 and what signs and symptoms that it's important people look for. Do you want to cover that, and then we can talk about some other current events with the hospital?
Absolutely. COVID can be anywhere from no symptoms to severe symptoms requiring hospitalization and even treatment in the intensive care unit. So there's a classic triad, and that is fever, shortness of breath, and cough and congestion. So that's what we call the triad. And so those are the three key symptoms to watch for from the standpoint of the patient. There's an incubation period, so that's where the asymptomatic part comes into play. Patients can be walking around not having any symptoms but still be infectious from the standpoint of droplet infection from coughing and sneezing. And that can last anywhere from 2 to 14 days. So a person could get a COVID test on day one and still be incubating and not have enough of a viral load to show up on the test, and then be retested on down the line 3 or 4 days and be positive. So sometimes there is rationale with persistent symptoms for repetitive tests. But you can get GI symptoms, nausea, vomiting, diarrhea. One of the things that's overriding in the patients we've seen is just the severe fatigue, the point that they can hardly get out of bed. Exhaustion, fatigue, tiredness, and then there is potential for loss of taste and smell. And so that is the big deal. But you can also get muscle aches, body aches. And so it has symptoms similar to other type of flu-like or viral-type illnesses, but it doesn't go away, and it just becomes much more severe. The big key early on was the patients that were at higher risk, those patients over 65, those patients with multiple health issues, heart disease, lung disease, kidney problems, liver disease, as well as folks that had autoimmune diseases, rheumatoid arthritis, inflammatory bowel disease, and those people taking immunosuppressives or prednisone or cortisone type medications. What has transpired now has been a big influx in those folks in their 20s and 30s due to social gathering and congregate living. And so those folks have really increased the spike in recent COVID cases. Fortunately, the majority of those individuals are less severely affected, but they can, if significant enough, they can end up in the same situation that the folks with predisposing conditions have and end up in the hospital and be very, very sick.
How about the patients that may have symptoms or may not have symptoms but could still be spreading disease around, or spreading infection around? Are you seeing much of that? Like maybe they don't have some of the severe symptoms you mentioned, but they can still be a vector, right?
Yes, we're seeing those more in the primary care physicians' offices. And this kind of rolls into the change in the mandate by the Ohio Department of Health and the CDC, recommending that if you are exposed to an individual who has known COVID, even if you're asymptomatic, if you've been exposed to them for even 15 minutes, it's recommended that you quarantine for 14 days. And that just came out on the 18th. That is in difference to the previous recommendations that didn't have that. So, again, because of a large percentage of folks in the younger age groups with no symptoms or minimal symptoms, this becomes a risk factor and, again, a vector, an ability to spread the disease quite rapidly. And I think that's where we're seeing the big uptick in positive tests in Stark County, Ohio, and nationally. But unfortunately, we can't just correlate that all with the infections that are occurring, because we're still seeing them in the at-risk populations. As such, we've seen the mortality index go above 200,000, which is just an astonishing number of deaths in our country.
Speaking of tests,
excuse me, is the temperature? Everybody's checking your temperature. Okay, you can't get into a medical building, bunch of all that kind of stuff. Is a raised temperature in every case a symptom?
The answer to that is no, but usually. In folks that are immune suppressed, they may not be able to develop a fever or a temperature response. But in the vast majority of folks, they're going to have a temperature of above 100 or 100.4. And so that's where that cutoff is. It's probably the easiest way to screen folks at the onset and to stratify them. But obviously not everybody with a temperature has COVID. But it's probably the easiest mass screening that we can do to stratify people when they're going into public places, especially the hospital and nursing homes, jails, schools, those type of things.
Do you think the forehead thermometers are very accurate?
I think they're accurate enough. Obviously, we don't have the ability and time to do oral temps or temps in other body orifices. So
sure.
The forehead or temple temp is generally pretty accurate, within a half degree to 1 degree.
I see. Okay. Well, I noticed my temperature, it was always 98.6. Okay. Now it's 97.0 or something, 0.0. So maybe that's what the variance is. I have no clue. So
yeah, the variance between an oral or rectal and a forehead temperature is about 1 degree. So.
Yeah. Okay. Okay, bottom of the hour, time for the news, Doctor. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment. Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Today, Brad and I are discussing Mercy's acquisition by Cleveland Clinic with Dr. Michael Linz, and we're also talking about COVID and many other things related to healthcare. So we've got a lot more to cover this morning, so let's get back to the show.
Dr. Linz, how's COVID-19 affected hospitals and healthcare systems financially?
Well, it is almost devastated much of the healthcare industry. The economic impact in a period of 8 to 10 weeks was something we've never faced before. Estimates showed that Mercy lost somewhere on the lines of $38 million over the period of time. Baldwin Hospital, $51 million. And the Cleveland Clinic, over $200 million just in that short period of time. So the impact across the nation was billions of dollars. And there's estimates that at least as much as 100 hospitals may close across the United States as part of contraction due to economic stressors. There has been some economic relief from the federal government and state governments, which is very appreciative, but obviously still doesn't make up for the loss of revenue. And those are, significant jobs in Stark County. Altman and Mercy are two of the top 5 employers in our community. And it was very difficult when the work staff had to take layoffs and furloughs as they were, also trying to work through this and take care of very, very ill patients. So it was a very stressful time for those period of months, and recovery is going to take quite a bit of effort. And we're still not quite back to our previous volumes from the standpoint of ER and hospitalization and surgeries that we were pre-COVID.
Wow. So what about testing? Can you give us an update on testing?
Sure. You can only go as fast as things will allow. This is probably the first time where the drug manufacturers and biotech folks have accelerated things so quickly, which makes people a little uncomfortable or scary, myself a little bit as well. But as one of the phrases we use is the virus makes the rules. So we have to take what the virus gives us as far as the ability to have testing, have enough equipment, have vaccines made, et cetera. So while we have a greater aliquot of testing supplies and testing at our hospital and as well as the other local hospitals, we are still not fully flush so that we can test everybody as much as we'd like. So there's still a stratification of who gets tested first. Not everybody who comes into the hospital is tested, except those with symptoms or those undergoing surgery. So it still has a ways to go. And so the tests are being still divided to those areas that are in greatest need and then kind of trickled down from there. So we are more adequately supplied than we were, but we still are not supplied to the point where we could test everybody as we'd like to. And there are two different types of tests, one that looks at the nucleic capsid capsule, and one is the antigen test. And the antigen test is the one that's not quite as accurate. Now, we have some newer tests that are called Pcr tests that are that we can run and have a result between 60 and 90 minutes. So that's been a game changer for us in folks in the ER and coming into physicians' offices and being tested. So at least the speed and rapidity with which we can get test results back has significantly gone up.
Well, what do these tests cost? You have any idea?
Honestly, I don't know. Testing has been provided predominantly at no charge.
Sure.
I mean, the federal government is picking up, and state governments are picking up those charges. So I really cannot answer that. I can definitely get back with you offline.
It's a curiosity, and I'm thinking, oh my gosh, people get testing all over the world and all over the country. And are these tests very costly, or are they, relatively inexpensive, or because they were all developed in a quickie time, as near as I can remember? And
yes, they were, and there's various degrees of false positives and false negatives. They didn't have the time to go through traditional phase 3 trials. So the trial was in real time. I don't say the guinea pigs, but the trial folks were those people being tested and those people being evaluated. So, but I don't know the cost of the test. Obviously, there has to be a financial burden on our healthcare system, the federal government, because somebody's paying for them. So.
Sure. Somebody's paying for them. Ain't that the truth? What about a vaccine? It's being developed on several fronts, and there's a lot of people, I'm not going to get that shot because it's taken too short a period of time here to put it together. So, and then there's those people who want it. So when it comes out, it's going to be safe and effective?
I believe it will. Part of what we're doing in preparation is also antibody testing, testing those folks who may have been exposed or did have illness to see if they've developed antibodies. The thing we don't know, and the reason why vaccine is important, is we really don't know at this point if the antibodies are effective in preventing recurrent disease, and if so, for what period of time. That won't be something that will be known for a while until all the epidemiological testing is underway to a greater degree, and patient tracking is underdone. So a vaccine is hugely important in trying to bring this under control. And a vaccination is really a chemical way of developing herd immunity. You can develop herd immunity either by natural exposure or by vaccination. Right now, there's only 3% of the country that has immunity, so to speak, felt to be to the virus. So we'd have to either have 200 million people exposed or 200 million people vaccinated to have this undertaken. So the vaccination program is going to be very important. Again, similar to the polio epidemic and the vaccinations, back in those days, and smallpox and those areas. There are 7 major manufacturers between biotech companies and pharmaceutical companies that are working on ventures, and it's good that they're all working and developing. Interestingly, every one of these companies is being subsidized by one of the governments, whether it's the U.S. or Great Britain, China, Russia. There's billions of dollars in research, and those billions of dollars are fast-tracking the process. And so the phase 3 trials, which is the human trials, have anywhere from 30 to 60,000 patients enrolled. So they're trying to do the trials similar to what is done in the past, but are doing it at a much quicker pace because they have the funding to do so. The interesting one is Johnson & Johnson. They may have a single vaccine that for immunization, and so that would also be a game changer. But the others are all two-part vaccines.
Mm. So, is there any country or in the world or any race that has shown to have immunity to this disease? Natural immunity, no. There are various countries that have had various degrees of success in their isolation programs and their preemptive protective programs, but that success is short-lived, as everybody gets mask fatigue, isolation fatigue, and at some point people want to go on living what's called a normal life, although the normal is definitely a new normal. And that indelibly has caused a surge in our infection rate again. So there are definitely certain countries that have done a better job than others, certain Scandinavian countries, certain small countries where the government can control things to a greater degree. But again, they're having surges as well, and as eventually life goes on and attempts to go back to some degree of normalcy. Amazing. But I think the vaccines will be available in 2021.
I think it might be short-sighted to see them in 2020. Again, because of the safety aspects, the AstraZeneca group did have a significant adverse reaction to one of their patients that got the vaccine. That was put on hold, now restarted. So, obviously we don't want to see the testing and the volunteers to test develop significant side effects.
But they went back, AstraZeneca went back to phase 3 testing, didn't they?
Yes, they did just last weekend.
Yeah.
They vetted it fairly well. And so I think these are reputable companies that, from a liability standpoint, obviously we want to be careful as well. And there's going to have to be some degree of belief in the system that it works and to get things out. So we need it, obviously, in our healthcare worker population and our at-risk folks with chronic disease, our healthcare workers, and those that are in large populations of congregate living. So if you ask me if I'm going to take it, yes, I am.
Okay. Even out of the gate, huh?
I may not be first in line, but I'll be the first in line for my group.
Yeah, well, okay. I keep thinking, okay, there's so much negativity on this. Oh, you can't develop this fast enough. This is too fast. Takes 20 years or 15 or 10 or what. Some of the flus have never had one of the diseases that never been able to develop a vaccine against. I don't remember what it is, but there's just so much negativity on all this, and I'm thinking
this one has been much more difficult than influenza and some of the other viruses. But from what I've read in the evidence-based medicine in the literature, I think things look very, very positive, and it's really what we need to hang our hat on.
Okay, the Russians already have one. What's the deal there? Do you know?
I wouldn't be standing in line for that vaccine.
I know. Well, they developed that very quickly, so I've heard. So, we probably should take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, welcome back to Health Matters. We're talking with Dr. Michael Linz from Mercy Hospital today.
All right, Doctor, how about you give us an update on the acquisition of Mercy Medical Center by the Cleveland Clinic?
Well, obviously, COVID, as you know, affected so many things, and it affected the initial acquisition of Mercy by Cleveland Clinic. Things have been moving along well. Due diligence had been taking place, and there was an initial date of acquisition of July of 2020. When COVID hit, obviously everything got put on hold and pretty much stopped in its tracks. We have reinitiated our negotiation process with the Cleveland Clinic in June of this year, going along very, very positively. And the expectations are, if all goes as planned, that the merger and acquisition will complete itself the first week of January of 2021. So the Pope has already signed off. So
I'm not kidding. Okay.
Truly, it had to go to Rome and had to be vetted. And
that's what I heard. Wow, how interesting.
So let's talk about the positives for Mercy in Stark County.
Well, I mean, the positives for Mercy as essentially a standalone hospital or a very small group of other hospital entities as part of the sister charity is the economies of scale, the ability to influx capital for IT and for electronic health records. These are extraordinarily costly, and being able to use their system and their buying power will provide us with a significant improvement in infrastructure. Also, they are cutting edge in research, and so that'll allow research protocols, especially in hematology and oncology, to take place here, infectious diseases, et cetera. Having the ability to be part of the Cleveland Clinic system will allow us to have better direct access for those people who need the clinic for tertiary care, and it'll also improve our medical education and our ability to bring new physicians in various specialties down to our community and to our hospital to strengthen those areas. And really, this is an acquisition that's going to provide the long-term viability of Mercy as an institution. So it's hugely important.
Wow. That's just, is there any, I mean, there's not much land left there at Mercy to expand outward, whatever. Is there any plans in that?
There's been some discussion about redoing the tower and those type of things, but right now with the changes in hospitalizations for folks, there may be a new paradigm as far as hospital sizes and what you need. It may not be the size of the hospital, but the programs you have inside it.
Sure. So the dialysis center, which is there, what's been the effect on those people with this virus? Well, they're at significantly higher risk, and so sure.
Those folks are very isolated, and the amount of personal protective equipment that both they wear and the medical personnel is very, very high level.
I see.
They are cared for with kid gloves.
Okay.
One of the questions I know was concerning for those in the community and for the hospital itself and for the sisters was, the Catholic healthcare identity, mission, and values. And the one thing that the Cleveland Clinic has stressed and is very strongly about was for Mercy to keep its Christian identity and to continue with outreach programs, helping the poor and underserved. Their idea, which is a different tack than what they may have been known for, years ago, is they're not going to come in and turn this into the Cleveland Clinic canton. We're going to continue to have the local flavor, the mission and values, and the programs that are in place, and continue to grow and develop those for the community. So that was tremendously exciting for me, and that's been a consistent voice from the folks from the clinic who've been down here working with us.
So what about, let's talk about the new things going on at Mercy. Can we talk about telemedicine?
Sure. Telemedicine was kind of a cottage industry over the last few years. It's been something that's been slowly evolving, mostly in the extended care population, in the nursing home population, where folks in extended care facilities, where it's difficult to get physicians to get to, or they have a large patient population and it's hard to be seen in a timely manner. Those folks can be seen by telemedicine or televideo with a nurse there, and the ability to see people as we are right now. The COVID pandemic really brought that to the forefront because pretty much due to the infectivity and concern of people communally being together, but people still needing their health care and their prescriptions, their medications and counseling and whatnot, the telemedicine program really took off. And so it has become a mainstay. And for the early period of time when everybody was home isolated, it was the only means of being able to be seen by a physician. And so it now is going to be here to stay. Also, there are some government rules and regulations and payment restrictions that were lifted by the government, and that's also helped to spur the industry and to provide capitalization for that as well. While that the amount of telemedicine visits has gone down a bit, but it's still a significant percentage of people that are seeing their physician over their computer or device. And so it's just a great asset to providing health care, especially to those that are shut in and those people that live in rural areas. So it will also be a game changer for healthcare for the future.
What's happening with the Edward Peel Coleman Community Center renovation?
Well, that's a very exciting program. The Coleman Center has been there for many, many years, a mainstay of the Southeast End community. I have a connection to the Southeast End as my father was the principal at Lathrop Elementary School in the 60s and 70s, so I spent a lot of time there. And I actually grew up in the Southeast End off of 3rd and Tusk in my younger formative years. So that's an area that's always been an area that has been close to my heart and one that I've been involved in one way or the other. But the city of Canton, together with Mercy Medical Center, have initiated a joint venture in repurposing the Coleman Center, not just for recreation, but they'll have physicians' offices there. They'll have a dental clinic, counseling, as well as the other social services for that area in the community, which is more impoverished and is a greater challenge. So that's very exciting to have a footprint and provide those services to that area of the community, which has not really had a local physician practice there as a mainstay. And so,
okay, Doctor, this is the end of this show, and I don't know what we're doing next. I guess I close it out, right?
Yeah.
Okay. Doctor, thanks very much. Dr. Michael Linz, Chief of Hospital Medicine at Mercy Medical Center. Very good show. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center and Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.